Hello, my name is Patricia Stillwell, and I will be doing an assessment on my husband Curtis. Curtis doesn't have his glasses, so I'm going to be reading the consent. I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable. Do you agree to this, Curtis?
Yes, ma'am.
Okay. Can you tell me your name?
Curtis Stillwell.
And can you tell me your date of birth?
8/7/61.
Okay. And can you tell me why you're here?
Chest pains.
Okay. When did your chest pain start?
2 days ago.
Okay. And between a 0 and 10, how would you rate it right now?
8.
Okay. Excuse me just 1 second. Could you please call an ambulance? We need to have a patient transported via ACLS squad. Let them know that he is having chest pain and he needs to go by ambulance. Thank you. Okay. And what were you doing when the chest pain started?
I've been mowing grass, weed eating.
How long did it last?
It lasted about 10-20 minutes.
Okay. Is there anything that made it better or worse?
No.
Okay. Are you allergic to any medication?
No, ma'am.
Have you ever had a heart attack before?
No, ma'am.
Okay. Have you ever had a stroke before?
Yes, ma'am.
Okay. Do you have high blood pressure?
Yes, ma'am.
Diabetes?
No, ma'am.
Any kind of respiratory or lung problems?
No, ma'am.
Okay. I'm going to do a quick set of vital signs, and we're going to ask the questions until the ambulance gets here, okay?
Yes, ma'am.
I don't want you to be alarmed by having to call the ambulance. We just want you to be able to have some stuff done to figure out why you're having the chest pain. They'll probably do an EKG on you in the ambulance. They'll start an IV. And they'll get you on some oxygen and give you some nitroglycerin to see if that helps relieve your chest pain. Do you take the baby aspirin?
Yes, ma'am.
Okay. Do you take a full strength aspirin?
Yes, ma'am.
Did you take your 325 today?
Yes.
Okay. I'm going to get your blood pressure. Okay, your blood pressure is a little bit elevated. It's 190/80. Does it normally run that high?
Yes.
Okay. Have you taken your blood pressure medication today?
Yes, I have.
Okay. I'm going to get your pulse. It's fine. It's 90. A little on the high side, but that's not unrealistic. I'm going to listen to you. Just breathe normal. I'm just listening to your heart. Okay, heart sounds are normal. S1, S2, S3, S4. No rubs, murmurs, or gallops are heard. Okay, I'm going to listen to your back, listen to your lungs. Just take a deep breath for me. Another one. Another deep breath. And one more. Okay, I'm going to listen to the front of your chest. Take a deep breath for me. Another one. And another one. Okay, can you tell me if you've had any swelling in your legs recently?
No, ma'am.
Okay, I'm going to check and see. Okay, there's no edema in either leg. Posterior tibial pulses are 2+ bilaterally and palpable. Dorsalis pedis are 2+ and palpable bilaterally. Curtis's skin tone is a little flushed. It could be from his blood pressure being elevated. His skin is not clammy. It's dry and cool. He's not diaphoretic. He's not sweating. Are you having any nausea at this time?
No, ma'am.
Okay. He's not nauseous. We're going to go ahead and ask some questions until the ambulance gets here. Okay, you told me that you have no drug allergies. I'm going to go over your list of medications and see if anything's changed. Systolic 10 milligrams once a day.
Yes.
Nexium 40 milligrams once a day.
Yes.
Okay, a 325 aspirin once a day.
Yes.
And you did take that today to verify that?
Yes.
Okay. A fish oil over the counter 1,000 micrograms once a day.
Yes.
Garlic pills 2,000 micrograms once a day.
Yes.
Vitamin C occasionally. Did you take it today?
Yes.
Okay. And you use an inhaler as needed. Do you have any lung problems such as COPD or emphysema?
Yes.
Okay. Are you having any shortness of breath now?
No.
Okay. When the paramedics get here, they will probably put you on oxygen. They will do a 12 lead in their ambulance, and they will probably start an IV in case they need to give you medications. They may even give you some nitroglycerin or some morphine along the way to kind of help relieve the chest pain that you're having. Does your pain move anywhere or go anywhere?
No, it stays the same.
Okay. Is it in your arm or your neck, or does it just stay in your chest?
Chest of my arm.
Okay. Which arm?
Left arm.
Okay. I'm going to ask you a few more questions on your assessment. Can you tell me if you have a religious preference?
Baptist.
Okay. Are you married?
Yes.
Does your wife know that you're here today?
Yes.
Okay. Does she know that you were coming for some chest pain?
Yes.
Okay. Is she here with you today, or do you need our office to call her and let her know that you've been taken to the hospital?
She's here today.
Okay. Okay. I'll let her know that we are going to be taking you by ambulance to the hospital, and she can follow, okay?
Yes, ma'am.
Okay. Do you smoke, Mr. Stillwell?
Yes, ma'am.
How many packs a day do you
2
smoke?
packs a day.
Okay. How long have you smoked?
20 years.
Okay. Would you be interested in smoking cessation, a smoking program, try to help you get stopped?
Yes, ma'am.
Okay, we'll refer you to that. First of all, today we're just going to make sure that we take care of the chest pain that you're having, okay?
Thank you.
Okay. And there's the paramedics, so we're going to let them take you to the hospital, and at the hospital they will probably put you on a monitoring system where they can watch your heart. They may give you some medication. They're going to draw some lab work and get something called cardiac enzymes to check and see if you've had any kind of a heart attack or anything's wrong with your heart, and then they'll go from there and see what medications you need and what treatment.
Yes, ma'am.
Okay? I hope you feel better, Mr. Stillwell.
Thank you.
Thank you for coming in today.